Going to begin the skill of feeding the client who cannot feed self now. This skill will be done on a fellow student. The student will be in the bed. This will not be done on a mannequin, but for video purposes today, we will be doing this skill on a mannequin. You will have your tray ready. Your nurse evaluator will have it ready. You will usually have 2 pieces of fruit cocktail on the tray, maybe a peach and a pear, or 2 different items so that the patient can choose. You will also have some water. So I've got my food tray here and I'm ready to begin. Remember that we always do the same pre-procedure action. So knock, pause, enter. Hello, Miss Jones. My name is Ann and I'm going to be feeding you today. I'm going to do my peanut butter sandwich as I do at the beginning and end of each skill. This will help us pass the CNA test because these small little habits really help in passing this part of the test. So we'll do peanut butter sandwiches. P, provide privacy. B, make sure the bed is low and it is locked. S, you've got your signal light. And W, wash hands. So I'm here with the food tray and I'm going to pick up the name card and I'm going to ask client to state name. What is your name, please? And she says her name is Mrs. Jones, so I'm ready to begin feeding her. So I'm going to go ahead and pull the food tray across her bed. I'm going to sit her all the way up. We have to sit them up to 75 to 90 degree angle. I tell my students to sit them all the way up so that we're not guessing what 75 is. Let's sit them up to 90. Okay, she is all the way up now. I'm going to position this tray where it can easily be seen by client. Remember that all these steps are steps on the CNA test. So I've got all my equipment here ready to go. I've got my chair because we are going to sit in a chair facing the client as we feed. I'm going to clean your hands, Mrs. Jones. If I can see your hands, please. We'll be doing this on a real student, another person, so they'll be able to give us their hands as we clean their hands with the hand wipe before we begin feeding. Okay, we've got everything in position here. I'm going to sit in a chair facing her. All right, Mrs. Jones, here we have a peach and a pear. What would you like to eat first? A peach? Okay, here's a bite of peach. Are you ready? She says she's ready. I give her a bite of peach. Okay, I get a bite of pear. I tell her the content of each spoonful. I ask her if she's ready for each bite. Here's a bite of pear, Mrs. Jones. Are you ready? Here you go. She's ready. So I give her a drink. I ask her if she's ready before I give her a drink. Mrs. Jones, here's a drink of water. Are you ready? She's ready. I give her a drink of water. So that is, the feeding is complete. So now I'm ready to clean her mouth and her hands with the hand wipe. Remember, everything I'm doing on this and showing you is a step that we want to do. There are quite a few steps on the feeding skill. We're going to remove tray to the designated dirty supply area. We're going to leave Mrs. Jones in an upright position on the conclusion of this skill, but we are going to do our other post-procedure actions, which include remove privacy, P. B, ensure the bed is low and locked. S, here's your signal light, Miss Jones. Call me if you need anything. And W, wash hands. And that concludes the feeding the patient who cannot feed self skill.